Next week, the State Office of Addiction Services and Supports will air a 30-minute special called Addiction: The Next Step on Channel 4. It addresses the impact of opioids and the overdose epidemic statewide.
To talk more about the impact and the resources available here in Western New York, right now we are joined by Erie County Health Commissioner Dr. Gail Burstein. Dr. Burstein, thank you so much for joining us. This is a really important conversation. Let's first take a look at the numbers. How does this year compare to 2023 so far?
Well, so far this year, we've seen an increased number of overdose deaths as compared to the same time last year. So unfortunately, we're on track to be as high or higher. But in 2023, we know that we did see a significant increase compared to 2022, where there were 435 total overdose deaths, which is 15% more than in 2022. And as far as our opioid overdose deaths, there was almost a 20% increase compared to 2022. So, we're not in a good place right now. And that's where we really want people to know about all the resources that we have available in Erie County. First of all, we have a lot of Narcan available to Erie County residents. And we also have resources to train people about what an overdose looks like and then how to use the Narcan. All you have to do if you want Narcan is to text 716-225-5473. And all we need to know is where you need us to send the Narcan. We also have fentanyl test strips. So, people will know if the substance that they're using also has fentanyl in it. And we also have xylazine test strips. We know that we're seeing a lot of people who are overdosing who think that they're taking cocaine, but they're really taking fentanyl with or without the cocaine. We know that also there's a lot of pills out there that are being advertised as being, say, Adderall or benzodiazepines, but they're really spiked with fentanyl, and those are also very toxic. So it's really important that people have Narcan on hand. And if you're using, it's important not only to have Narcan, but somebody there with you that can rescue you if you overdose. Because if you overdose, you may not be conscious enough to give yourself the Narcan. So if you can, make sure that you use with a friend in the room who's not using. If that's not possible, there are a lot of services available out there that can call you and and stay with you on the phone. And if you fail to respond, then they will call 911 and get help for you.
And Dr. Burstein, what about other resources beyond just Narcan and having someone? Resources to maybe help heal some of these people who are using.
That's a great point. Having any type of substance use disorder is so stressful, and there's so many things to navigate. So we have peers available at the Erie County Health Department that can, help folks out, like help them navigate, where to get treatment, where to get harm reduction services. All you have to do is call us at 716-858-7695. And these are people with lived experiences. They've been through it before, can help people through it. Also, if people are ready to start treatment, you can actually, in Western New York, pretty much go to any emergency department, either in person or virtually, let them know that you're ready to start treatment for opioid use disorder. And right then and there, you will get a prescription for buprenorphine. If you can't afford to pay for it, there will give you a voucher that will cover the expenses of the buprenorphine. And then at the same time, they'll give you your first appointment with a substance use treatment provider. So you'll have a short-term fix with buprenorphine for a couple of weeks, and then being able to start your treatment with a long-term substance use treatment disorder with a therapist of your choice. It's the place that you want and the agency that you want.
Wow. It is safe to say that there are a number of crucial resources right here in Western New York for anyone in need of them. Like I said, this is a really important conversation. So Dr. Burstein, thank you so much for taking the time to join us and share those resources with our viewers.
Yeah, well, thank you. Thanks for listening.
Thank you.